So there's a series of 8 charts here, and I'll go through them fairly quickly, but they all have something in common. They go up from left to right. So the amount of health information processed and stored digitally has been going up. We have pushed healthcare organizations to put their data onto computers and connect those systems. We have rising levels of cyber criminal activity. This is something which has occurred independent of healthcare, but impacts healthcare as cyber criminals have shifted from things like credit card theft to identity theft to ransomware. And the level of cybercrime activity is higher today than it's ever been. The value, as I mentioned, of the data stored by healthcare entities has been rising. It is worth more and more on the black market, and the complexity and breadth of health IT systems increases. One CISO in healthcare that I interviewed said, "You know what? It's really good that I've been in the business a long time," referring to himself. He's been in IT 30 years. He said, "Because I came into healthcare security from defense, and what I saw was more legacy stuff than I'd seen in a long time. But at the same time, healthcare organizations are rolling out cutting-edge stuff. They want to do telemedicine, they want to do patient monitoring, and the latest stuff, and certainly mobile distributed digital device stuff. So it's clear that expands the challenge and the attack surfaces. It has a regulatory burden. And we don't see the same kind of fines imposed in different sectors as we do in healthcare. And I think one of the impacts this has, I'm still researching this, but I tend to find that CISOs in healthcare are less willing to talk and communicate about what they're dealing with, potentially because of this. I mean, it might be because they're just so busy, they don't have time. But this regulatory environment is quite different and quite complex relative to, say, banking or retail. The next chart is the Cobb Granularity Index. This is something I've been trying to work out, and I'm not finished with it yet. But it's a function of the number of parties that are denied less than full access. So you've got a granularity. Somebody can see part of the record, but they're not allowed to see the other parts. So for billing, somebody might be allowed to see what they're billing for, but not the test results and so on in detail. Times access scenarios per unit of time. And I think there's probably a third dimension there, which is urgency. You have this need to share some data very quickly in healthcare, and that is difficult. What you might call the life and death factor. So the probability of security breach resulting in physical harm to humans times the number of breaches. And we've seen a lot of breaches in healthcare, and this is obviously just a representation, but again, talking to some CISOs in healthcare, they're like, the risk calculus is quite different because some of this information is life and death information. And so finally, the cybersecurity skills gap. In general and in healthcare, the number of positions that are open for more than 100 days, for example, would be one measure of that, and that's been definitely going up.